Okay, hi everyone. We'll get started. So good afternoon, and thank you for joining us today. Our chair is David McNeil, who's a former RNAO president. I'm going to give a brief description of the technical aspects and House rules for the webinar, and then I'll turn the session over to our chair. You'll see a photograph of the chair or of each candidate as they're speaking, unless other material has been provided. Providing material was optional and not mandatory of the candidates. And you can now find it online as well with the archived webinars. If you'd like to ask a question of the candidates, in the bottom right-hand corner of your screen, there's a chat box. Please type your question there and state the name of the candidate to who your question is directed to. We will ask the question to that candidate, and then the other candidate will also have an option to address the question. And we'll continue that way in a rotating order. Okay, please type and send your questions to us as you think of them, so we can collect the questions and have them prepared. And after all the candidates have given their introduction, we'll move on to the question. Home Office will flash the question on the screen. The candidates will have 1 minute to respond, and the chair will read out the question. And they will see a warning on the screen when they have 15 seconds left to speak. And then if they go over time, I'll come on and ask them to stop. So I'll now turn the session over to David.
Great, and welcome everybody to today's webinar for the position of President-elect. The candidates running for election are Carmen James Henry and Carol Timmings. So just to go overview, just give you a bit of an overview of the process for today. So what we will do is we will begin with each candidate being asked to speak in the alphabetical order as above. The reminder that for each of our candidates, you will have 10 minutes to speak, and they will be timed. Also, candidates are reminded that they will have only 1 minute to respond to a question. A reminder to the members joining us online, you are encouraged to type and send your questions in, and we will deal with them after all of the candidates have spoken. So just so that I can be clear with our candidates, would you like me to give you a 1 minute warning when you have 1 minute left in your 10-minute speaking section?
Yes, please.
Yes, please.
Oh, okay, that would be good. So I guess we'll start with Carmen, and if you would like to go ahead and start your part of the session, and I'll let you know when you have a minute left.
Okay, thank you. Nursing colleagues, thank you for the opportunity to introduce myself. My name is Carmen James Henry. RNAO is celebrating 90 years as a members association, and as one of the candidates for the position of President-elect, I know I'm able to provide leadership to continue to provide this credible voice of influence for nursing and health in Ontario. Tonight is an opportunity to share with you, or this evening is an opportunity to share with you my vision for Essential, my vision of the essential role registered nurses have in our publicly funded healthcare system. You need a leader who will collaborate with members and key stakeholders to advance healthy public policy, promote diversity, and ensure registered nurses have healthy work environments and access to lifelong learning. You need to know who I am, my values and viewpoints, and what you can expect from me as the 2015 President-elect. My colleagues, I'm confident my knowledge and experience will inspire you to vote for me. I have been fortunate and worked hard to continue my education to be a lifelong learner, to fully understand that learning never ends. So I've been able to, over the years, acquire not only my registered nurse's diploma, but went on to do a Bachelor of Science in Nursing and a Master's in Education, and also have certificates in parish nursing and a certificate in midwifery from the UK. My practice spans 40 years as a registered nurse, and one of my strengths is that I've worked in most of the sectors of the healthcare system. you will see that I have a varied career experience that will be invaluable in relating to and understanding the challenges being faced by you, my colleagues, who are at the forefront of the healthcare system. I have worked in the acute and chronic care setting as a staff nurse and nurse educator. As a public health nurse in Toronto, with healthy promotion as my primary responsibility in healthy lifestyles, sexual health, and nutrition programs. The development and implementation of these programs were in my role of a school nurse, as a school nurse. In the provincial government, I worked with the Ministry of Health and Long-Term Care as a consultant, where my primary responsibilities were two major projects. One, the accountability agreement between the Ministry of Health and the Community Care Access Centers, and a nursing model of care for clients with hepatitis C. So I was involved in developing those. In academia, my academic work includes professor of nursing, educator of nursing, and clinical instructor at York and Rice universities. This may have been one of my most exciting and yet challenging roles. I told the story of entering into nursing by default. Although I had been accepted to Teachers Training College, I was advised to take the year after graduating from high school to work on upgrading my math skills. My family immigrated to the UK, so I applied to nursing school instead, and the rest is history. I was able to combine my passion for both teaching and nursing, and this gave me the opportunity to prepare future nurses for practice. In this important role, one of my favorite courses to teach was Professional Leadership and Change, which focused on preparing novice nurses starting their career for leadership responsibilities and to be advocates for change. I am able to influence and inspire nurses to be leaders. Today, a number of them are my colleagues and my mentees. In administration, as the Director of Operations in one of Toronto's tertiary care and teaching hospitals, my primary responsibility is managing all operational and clinical issues as a key decision maker related to hospital functions. In the context of this practice, this draws on every job that I have had. I am the go-to person in a vast array of responsibilities when decisions have to be made. As a key decision maker, I'm able to advise and guide staff, patients, and families through clinical, critical, and social situations and dynamics. My RNO involvement spans over or close to 25 years. I served as Board of Directors for Region 7, representative for 2 terms, a member of the Provincial Educators Interest Group, member of the Nursing Education Committee, International Nurses Interest Group, and the Policy and Political Action Executive and Networking Officer for the Parish Nurses Interest Group. And I had the opportunity to act as previous chair for the RN Journal Editorial Advisory Committee. Of course, I've participated in RNAO Queen's Park Day and Queen's Park on the Road, and those have been highlights for me in my involvement with RNAO. It has always been a privilege to serve our association and my community, and I'm honored to have received recognition for my contributions as an educator, a member of the community, and as a leader. And I was very pleased to have received the RNAO 2014 Leadership Award in Nursing Education, and I was more excited about that because this was my nomination was done by students. I was able to receive the RNAO Nurse Ambassador Certificate and RNAO Certificate of Appreciation Award. The University Hospital of the West Indies Graduate Nurses Award Distinction for Professional Achievement, Exemplary Leadership and Excellence in Nursing. Toronto Public Health honored me with the Professional Practice Award for Preceptors, and at St. Michael's Hospital, I received the Award of Excellence in Workplace Relations. Colleagues, from this overview, you now have some idea of my knowledge, skills, and experience, so you can be confident that I am a deserving candidate for the position of President-elect. I honor what we have accomplished in 90 years, and I acknowledge that there are many practice, policy, and nursing issues to be addressed, and we need to build on our professional association's influence on nursing and health issues. As you know, there are many initiatives that have been accomplished by RNAO, ranging from BPGs developed in Ontario, now used in a number of countries like Australia, Chile, United States, Spain, Italy, and China, the creation of nurse practitioner-led clinics, new grad and lay career initiatives, advocating for 70% full-time positions for RNs, the evolution of nursing and social policies. And one of the areas that RNAO has evolved and excelled is the area of advocacy on important issues such as a minimum wage, increasing minimum wage, banning pesticides, and of course, we were earlier proponents of closing the coal plants. So from that, you can see that we have come a long way in the 90 years that we have been practicing. Okay. I acknowledge the efforts of RNAO presidents, board members, and assembly members whose leadership over the years has developed our strong, credible voice in our partnership with policymakers, various professional organizations, key stakeholders, and the public we serve. My philosophy has always been the fact that it has been established that nurses are the cornerstone of Canada's publicly funded healthcare system. We have over 41,000 RNAO members with expertise in the various sectors of healthcare. And I want to be able to build on engaging the membership. I see this as a great potential to have on even greater number of members engaged. And I plan to be responsive to members who are in rural, remote, and urban settings and in all practice settings.
So, Carmen, you have a minute left.
Okay, RNAO is best positioned to advocate for comprehensive, accessible, and quality health care for all Ontarians, thanks to the success of programs like Queen's Park Day and all that we have been able to move forward. My values very much drive my leadership style of participatory leadership and collaborative leadership. And as I reflect on my journey, I recognize that diversity is one of my key values, as it includes national and cultural heritage abilities, socioeconomic status, gender, and sexual orientation. Therefore, diversity has always been paramount to my practice. I wanted to talk a little bit about the ends, but in the essence of time, some issues, I want to just key on some of the issues facing Ontario and how, as the President-elect, I will work to help to advance the role and image of nurses, influence healthy public policy to positively impact the determinants of health, and speaking out on emerging issues that impact nurses.
Well, Carmen, I'm going to have to ask you to wrap it up now.
Yes, okay. Okay, sorry. My paper here. Okay, so my commitment is to add to the legacy of strong leadership of Ontario, collaborating with the RNAO board, the membership, and our national and international partners. My mission is to support and engage the members to advance the nursing profession, promote the contribution of registered nurses as knowledge professionals, agents of change, and advocates for social justice. This campaign to be President-elect is a wonderful opportunity to share my vision. RNAO members know this. I have sustained my passion for nursing. I have diverse leadership and practice experiences. I have knowledge and skill as a volunteer and leader within RNAO, and I'm ready for the President-elect position. Again, thank you for the opportunity to speak with you this evening.
So thank you, Carmen, for that presentation, and much appreciated. Carol, I'm going to hand it over to you, and again, I will give you a 1-minute warning, all right?
All right. Thank you so much, David. Well, good evening, everyone, and thank you to all of you who have taken the time this evening to join the webinar. My name is Carol Timmings, and I'm very pleased to be running as a candidate for President-elect for the 2015-16 RNAO Board of Directors. And in the few minutes that I have to speak with you, I want to, I think, highlight 4 key areas that are part of my platform: knowledge, influence, passion, and engagement. And I want to start on the knowledge side of things. So I I am a registered nurse, and I hold a Bachelor of Nursing Science from Queen's University, and I also hold a Master's of Education with a specialty in Administration and Policy, also from Queen's. For over 25 years, my nursing career has spanned both acute care and public health nursing, and I have progressed through positions from staff nurse, management positions, and senior leadership positions across a range of health programs and portfolios, including health planning and healthy public policy. I'm currently the Chief Nursing Officer and Director of Chronic Disease and Injury Prevention at Toronto Public Health, and I hold a cross appointment with the University of Toronto Dalla Lana School of Public Health. Let me see. So I have served on the Board of Directors for the past 2 years, and in addition to that, I'm an active member of the Community Health Nursing Interest Group and the Nursing Leadership Network. And I have had over the years also the wonderful privilege of co-chairing and contributing to some of the expert panels on the best practice guideline development. I recently also had the opportunity to serve as a member of the Provincial Expert Panel on Primary Care. And that, of course, as you know, is an area within our health system that is going to be undergoing and is undergoing some fairly significant transformation. So it was nice to be part of a nursing voice on that expert panel. In addition to that, over the years, I have had the opportunity to serve on a number of provincial boards and committees, and currently do participate as a member of the Governance Advisory Committee to the Community Health Nursing Canadian group, to that board of directors. So I have had significant experience in that area. In 2010, I was honored to receive the Alpha Distinguished Service Award in recognition of my outstanding leadership and contributions to the health system in Ontario. And I felt very humbled and privileged by that recognition. I'm recognized as a collaborative leader. I'm one who truly values staff, client, and community engagement. Probably one of the hallmarks of my leadership is my commitment to the health and well-being of all in society, and in particular, my commitment to reducing the health inequities and disparities that we see in the communities and clients that we serve. And I'm also very committed to the social and environmental determinants of health. I've had the privilege of working with nurses and indeed other professions across Toronto Public Health in something that I describe as a transformative time in our organization, and that was our BPSO journey when we achieved our designation. And it was actually a real opportunity to sort of build a vision together of evidence in our organization and looking at client and patient impact. And it was just an amazing opportunity to really work to inspire and motivate not only the nurses and other disciplines in the organization, but to actually be witness to the improved health outcomes that we saw in the clients and communities we serve. So it was a phenomenal opportunity to see how the work of our association actually does transform and can transform organizations and actually have that real impact on the health and well-being of our clients and patients. I also recently led the development of a comprehensive public health nursing recruitment strategy here in our organization, and it resulted in the creation of an unprecedented pool of very highly qualified nursing candidates. And it's really exciting to see the tremendously diverse nursing workforce that are poised, I think, to join all of us in our work to improve the health outcomes of Ontarians. So that was a real honor for me as well to work with my colleagues in looking at the infusion of whether they're internationally trained nurses and new to our province and our country, or new graduates. I think it's just inspiring to see the cross-generational nursing workforce that we have. So as candidate for president-elect, I just want to take the last few minutes to really convey the level of commitment I have to working through the board and reaching out to you across our members across the province. RNs, nurse practitioners, students, we have an amazing group as members of RNAO, and I think this is an opportunity for us to really galvanize the knowledge and passion and influence that we have as nurses in this province to shape the future, not only of our own profession, but also of the health system writ large. So I think it really is both an opportunity and I think a responsibility of a group like RNAO to also ensure that our voices and our knowledge not only have the collective impact here in Ontario, but that we also use that to shape the health and the systems nationally and internationally. And I think we have a track record of doing that, and I think we're poised to just go to new heights. I think using our voice in terms of political action is imperative. I think that's something that we owe to the communities that we serve, and it's something that people expect from our profession. And I think the opportunity to do that in this organization is just incredible. And I'm really hoping I have the opportunity to do that together with you. I think as importantly, though, we also help others find their voice, and that's equally a role that we play as nurses in this province. I think we also have advanced significantly many of the healthy public policy issues, as Carmen mentioned, related to nursing scope of practice, making sure we have adequate levels of RN practicing in this province, and certainly to ensure that we maintain a level of excellence and person-centered care in our hospitals and primary care, long-term care, and in the community. I think nurses are at every vantage point, and I think that's critical. I think there are some emerging issues that we have to keep an eye on and that we have to be ever vigilant as we maintain our surveillance of the system in terms of looking at how we take full advantage of the legislation around RN prescribing. We want to make sure that RNAO is part of shaping that. And I think most recently, in fact, in very real time, we're seeing some very interesting models of care that are emerging in some of our Ontario hospitals, and I really think that we need to look at those models of care and the implications for patients' health and health outcomes. So in closing, if elected, I certainly promise to bring all of my energy and my leadership experience to bear on this role. You would have my unwavering commitment to our profession across all domains of practice. I think that inclusivity is critical to our collective force. I promise that I will lead
Carol,
with...
you have 1 minute left.
Okay, I will lead with integrity and transparency, and I want to listen to the issues that you as members have. I think together we can build on the rich legacy of our association and utilize our collective influence to improve the health and well-being of Ontarians. And I think that safeguarding our health system is critical, and I know that nursing is the heart of that system. So I think as we go to the heart of everything, I would be honored to serve as president-elect, and I hope I can count on your vote. Thank you.
So thank you both, Carmen and Carol, for those excellent presentations. I think we have two great candidates for president-elect, so I think RNAO is very lucky. So I guess this is the stage of the process where we ask those who are attending the webinar to put forward their questions, and I think they're supposed to put them on the screen. Is that right?
Yes, there's a question coming up.
Great. So where will I see the question on the screen? Oh, okay there. So do I read this question?
Yes, please.
Okay. So there's, and it doesn't say who this question is for, so I think I'll just ask each candidate to ask, again, in alphabetical order. There's a trend for governments to make policy directions and decisions based on economic interest versus research, best available evidence. Many of these decisions impact on health equity, determinants of health, promoting further inequity and inequality. How do you envision RNAO moving forward with this type of political environment? So I'll ask Carmen to respond to this question first, and then Carol, you can respond, and then I'll reverse the order next time. So Carmen, go ahead. You have a minute to answer.
Yeah, thank you very much. This is, I think, is an excellent question, and I know that we are a credible voice in Ontario right now around issues to deal with, whether the social determinants of health or anything to do with the healthcare system. And consequently, because we have already built that environment where we work collaboratively with the elected MPPs, and in our 15 or number of years going to Queen's Park, I think we can provide excellent leadership and explaining the importance of looking at and using the determinants of health as a bridge for us going forward in educating our MPPs. I think this is an important issue in terms of looking at what is happening right now for a number of Ontarians in terms of determinants of health, and more so issues such as poverty, and some of the ones that we've been working on is increasing the minimum wage. And I think sometimes if those things are dealt with, then
So Carmen, I'll ask you to end there, and Carol, I would ask you to respond.
Okay. So I think it's really critical that RNAO is really part of the policy-making process. And I believe that it's ensuring that we are part of those consultations, that we're at those provincial tables when key stakeholders are being engaged in in examining policy options and setting policy directions. And I think we certainly have done that. And I think we need to ensure that we're available and engaged in that process. I think we know how to integrate evidence into policy and then into practice. And I think we can demonstrate that we have done that and help to make that evidence available. I think it is always a question of balancing economic, political, and research interests, and they're not mutually exclusive. So I think RNAO can be a really strong voice for making sure that any policy direction, policy options are examined for the health equity impact that they're
Carol,
going to
I'll ask you to end there. So I think that was good. I hate doing this as chair, but everybody has such good answers. So is there another question? All right, so the next question is, and I'll reverse the order this time. I'll ask Carol to go first. I'll read the question. RNAO is amazing, but what is one thing you would change about it if you could? So Carol, I'll ask you to start, and then Carmen, you can have the floor after that. So Carol, go ahead.
Okay, I think RNAO is amazing, absolutely, or I wouldn't be putting my hat in the president-elect ring. But one of the things that I would change, and I'm committed to changing if elected, is the extent to which there is opportunity for member engagement. And by that I mean really going out to members and hearing about the real issues that are affecting the day-to-day lives of nurses working in this province. And then I would really capitalize on that together with the board to inform the issues that we as a board would undertake. I think we're a member-based organization. We're very committed to that. But I think really there is an opportunity here to create more a range of options for members to engage and be heard. And that's one thing that I think I would change. We would do more of that.
Thank you, Carol. And Carmen.
Thank you. And that's the first thing I wrote on, the only thing I wrote on my paper. So I totally agree with Carol. And I agree that membership participation and engagement is key to the organization moving forward. And that is one area, because I look, for example, that we have 41,000 members. And I think if each member, or half of that, were really engaged. What an awesome organization this would be. And so I would like to have more involvement in engaging members, where I not only sit in Toronto, but go out to the communities, to different areas of practice and urban and all the other areas where nurses in Ontario are involved, to see what are the issues for them and how they can become more involved in setting the agenda of the association. So I think membership participation, engagement, and increase in membership would be, and involvement would be the key for me in terms of changing. It is a member-driven organization, and we must not lose sight of that.
Thank you, Carmen. Is there another question? More questions, please. You guys are just so concise, and you've answered everybody's questions.
Sorry, we did get one more question, so we're just posting it right now.
You're just posting it? Okay. All right, so I will go back to Carmen starting, and the question, I'll read the question, then Carmen, I'll ask you to answer it. How should RNAO be involved in health system reform? Nurses are central but not treated as such in new programs that address the unmet needs, yet many relate to the cuts in nursing. So, Carmen, I will ask you to start with that one.
Okay. There again, I would see that as the voice of nurses, or the voices of our many members, and I think that is where RNAO is very good at relaying the issues that are relevant. And I think in terms of new programs, it's very hard to work on new programs when the programs that are in place right now to meet the needs of our clients and patients throughout Ontario are really not being focused on, because we have a system where RNs are being consistently cut and replaced with other healthcare givers that do not have the skills in order to do that. So I know we had worked on having 70% of RNs being involved in having full-time jobs. So I think the key here is consistently working with our MPPs to make sure that registered nurses and nurse practitioners have vital roles to play in the healthcare system, and utilizing them would guarantee that the patients get the best care that they need. Making patients...
So, Carmen, I will ask Carol now to take on the question, so thank you. Carol.
Okay, so I think there are a couple of ways that are really critical for RNAO. One is to, as we have already, do some forward thinking about system reform, not to be in a reactionary way, but put out our vision of health system reform, as RNAO has in the ECHO document, which actually talks about how we optimize the impact that nurses can have on the system. Where should nurses be positioned in the system to have the greatest impact? So I think that's number one. I think we have to be anticipatory and really not just wait to react to models that are, quite frankly, top-down and government-driven. Number two, I think we have to always be able to make the case about nurse-sensitive indicators. We've got to be able to demonstrate how nurses make a difference in patient outcomes. And we've got to be able to make that business case on the patient outcome front, but also on the optimal use of healthcare dollars. Because let's face it, health...
Carol, thank you very much. That was a minute.
Thank you. Yeah.
So are there other questions coming?
Yes, one question just came in.
Great. You guys are doing a great job. Sorry for having to cut you off. I'm just following everyone.
That's okay.
So here's the next question, and we'll reverse the order again. So, Carol, you get the opportunity to answer this one first. What do you envision RNAO's advocacy role can be at the federal government level?
Well, I think RNAO has an amazing role to play federally, and I think, in fact, we are playing it as we speak in terms of our intervener status with refugee health, making sure we're part of the conversation on end-of-life decisions. So I think we're poised to be real real political action and advocacy leaders. I think we have to make sure that we partner with our other nursing colleagues nationally and, you know, be a real strong voice on those issues. And I think we have to not be afraid to speak out. So I think it's courage. I think it's the courage to be part of that conversation and make sure that federally, policymakers know we're here and that we're not afraid to play an active voice in shaping that policy.
Thank you. And Carmen?
So I see this as we are doing and continue to do a good job provincially. So I see that as moving forward in getting federal government involved. And I see where using our international and national partners, how we work on that. For example, at the CNA level, we can work with them and collaborate with them in spreading the message to our federal government in terms of advocacy, what we see as, and I know healthcare is a provincial responsibility. However, the federal government, based on their responses, have been very vital in how healthcare is done in our province, and they have done situations where, like cuts to health funding, have caused us to do. So I think we need to go there and advocate more for our province in terms of healthcare and how it can be administered in Ontario with their support and funding as well.
Thank you, Carmen. Are there other questions?
We don't have any questions.
All righty. So I guess at this stage, then I would, do you want me to wait a second, or do you want me to just wrap up the teleconference, or the webinar, sorry?
Maybe we'll give it 1 minute, just in case someone's typing a question right now. Then we can wrap it up if there's nothing that comes in.
We'll wait for a minute then, and that's what we'll do.
Okay, thank you.
Well, seeing that there is no other questions, I want to first thank the two candidates, Carmen and Carol, for your commitment to RNAO and for agreeing to do this webinar. I think it's a great way for the members of RNAO to get to know the candidates and have the opportunity to ask you questions and for you to put forward your platform and ideas. So thank you very much for your participation. I'd like to thank all of you who've joined the webinar and those of you who have put forward very excellent questions for the candidates, and remind everybody to vote, and so that we can get good numbers of votes in, and again, really demonstrate that commitment to the association. And thank you to head office for coordinating the webinar. And with that, I think I will wrap everything up. So thank you to everybody.
Thank you so much, David.
Thank you. Bye-bye.
Night, everyone.
Bye.